Hello, my name is Jeremy Harris, and today I'll be teaching you how to take a manual blood pressure reading using a stethoscope and a blood pressure cuff. This tutorial could be helpful for any medical science students, such as nursing majors, PA students, EMT students, or anything of the sort, as well as anybody who's been told by their doctor to keep track of their blood pressure. This could be for various medical reasons, and it's good to know how to take one both manually and with an automatic, although today I'll just be teaching you how to take one manually. So first off, you want to assemble all of your materials. Obviously, you're going to need a stethoscope. This here is a standard issue stethoscope. Most stethoscopes at the tip, you have a bell and a diaphragm. The bell is the smaller portion on top, but today we'll be using the diaphragm, which is the larger portion on the bottom. As for the blood pressure cuff, we're going to be using a pretty standard issue blood pressure cuff. There are some variances between most of them, however they all have the same basic makeup, and the gauge is pretty much the same for all of them. The one piece to take in note here is the symbol here on the bottom. The circle with the line right there is where you put the pulse after you find it. That is the optimal place to place the pulse so you can hear it in the stethoscope. Most blood pressure cuffs have something of the sort, either a symbol, a line from the top to the bottom, or an arrow that points downward that says pulse here. Alright, so the first step is to actually find the pulse. The best place to feel the pulse is in the crease of the elbow, usually towards the inside, innermost part of the elbow, closest to your body. After finding the pulse, you want to grab your blood pressure cuff and place the previously mentioned mark directly on where you found the pulse. You want the line to go through it, or if you have the arrow, place the pulse where you found it directly under the arrow. When placing the cuff on the arm, you're going to make sure it is not too tight, but also that it is not loose enough for it to slip down on the arm. From here, you want to grab your stethoscope and put it on, and make sure that the diaphragm is facing downwards. So you want to slip the diaphragm under the mark on the cuff and hold it in place. You can hold it in place either by putting a finger on top on the bell or by placing 2 fingers on either side of the diaphragm. I find that placing 2 fingers on both sides of the diaphragm is the optimal way to hold it. So from here, you want to grab the balloon with the valve on top. You want to twist the valve completely clockwise into the locked position. This will allow the cuff to inflate. So before inflating, you want to take note of one important piece of information. That a normal blood pressure is 120/80, that would be systolic over diastolic, in millimeters of mercury, or points. So you want to inflate the cuff to about 30 points or millimeters of mercury over the normal systolic pressure, which is going to be 120. This means you want to inflate the cuff to about 170. So after inflating the cuff, you're going to want to twist the valve counterclockwise to begin de-inflating the cuff. You want to do this very slowly, and especially once you start hearing heartbeats, you want to make sure that the needle is going down 2 to 3 points for every beat. You also want to take note of where you begin to hear the pulse and where you lose the pulse. This is going to be your systolic over diastolic. You're going to begin to hear the pulse around 120, and you're going to begin to lose the pulse around 80. But it's not going to be exact, so you want to make sure you keep track of where the needle is when you begin to hear and begin to not hear the pulse. So again, you begin to inflate the cuff, You want to go about 30 points over 120. You then slowly begin to deflate the cuff, again letting the needle go down 2 to 3 ticks for every pulse that you hear. So she should have already heard the beginning of my pulse around 120 and should be losing my pulse about now. After you no longer hear the pulse, you completely deflate the cuff. After deflating the cuff, you want to remove your stethoscope and remove the cuff. And if you do have to take the blood pressure again, you want to let the arm rest for about a minute between each try, just to give the arm some time to rest.